The World Health Organization and Public Health England officially prioritise infectious diseases, yet these multi-billion-pound agencies failed at the hour of greatest need. A new briefing paper from the Institute of Economic Affairs documents these failings, revealing that both public health organisations dropped the ball on their primary duties and instead spread themselves thinly over a vast range of medical, political and social issues. It was PHE's first pandemic, but memories of swine flu were fresh in the minds of its scientists, and it made the classic mistake of trying to fight the last war. It was not agile enough to change course in light of new evidence. It failed in the basic tasks of collecting and sharing data, it was slow to increase testing capacity, and it made a conscious decision to reject the strategy of mass testing and tracking that had worked in other countries. The WHO had more experience of tackling new viruses, but had been criticised for its response to the first Ebola outbreak in 2014. Its praise of the Chinese government in early 2020 went beyond the diplomatic niceties required to maintain cooperation. It expressed doubt about human-to-human transmission long after it was obvious that it was taking place. It opposed the sensible precautions of travel restrictions and face masks. These actions were incompetent at best. PHE and the WHO have become, to a large extent, state-funded pressure groups, campaigning on a range of causes. PHE's first public action was to endorse minimum pricing for alcohol. In 2019, the WHO classified computer gaming disorder as a disease. Both organisations have obsessed over fizzy drinks and fast food. We need a World Health Organization, but we don't need the World Health Organization. Member states and private philanthropists should instead fund a politically neutral pandemic surveillance agency, focused solely on viral and bacterial epidemics. The USA, having withdrawn funding from WHO, could lead the way. The UK government is right to close down PHE. Its replacement should be focused on preparing and executing the nation's response to outbreaks of infectious disease. For too long, health protection and health improvement have been muddled together under the banner of public health. Of the two, only health protection requires government action. People can improve their own health, but they cannot always protect themselves from infectious or environmental threats. However we reform these agencies, and whatever we choose to call them, they should have one job, and they should do it properly.